Hello everybody, this is Namita Thapar, Executive Director of MCure Pharmaceuticals, and on today's show the topic is urinary incontinence. When we talk about women over 40 years, 1/3 of them suffer from urinary incontinence. Now that's a shocking statistic. What is urinary incontinence? How does it really impact your life? And what can be done about it? Let's meet Dr. Kiran today, second time on our show. Thank you so much. To understand what is this urinary incontinence and what is it all about? How does it impact a woman's life?
Wonderful to be on your show, Namita, as always. And now urinary incontinence is the most important topic, I would say. And I'm so glad you chose it because so many women and men suffer in silence. It is the loss of bladder control, which causes involuntary leakage of urine. How embarrassing. Can you imagine? And it varies in degrees. Like it could be just coughing and sneezing and a little urine coming out, or a sudden urgency to pass urine when the bladder contracts, and then there's no time to reach the bathroom and the urine comes out. And another is constant dribbling when there's overflow. So these are the various types of incontinence, and they occur both in women as well as men. 70% in women and 30% in men. And as you said, 1/3 of women around the age of menopause and beyond have stress urinary incontinence, which is the commonest. And for men, when they have enlarged prostate or prostate surgery, they have incontinence, which is overflow incontinence, leaking, etc. So these are the various problems. And of course, poor quality of life. They have to wear pads. Social life is limited. You can't go out anywhere. You become nervous, introverted, and embarrassed to tell your doctor. So I'm here today to tell every woman, please go to your doctor if you have the symptoms.
Help me understand, what are the causes of urinary incontinence?
Sure. Now let us take stress urinary incontinence, which is common in women. Pregnancy, childbirth, vaginal deliveries when the muscles are stretched and the sphincter of the bladder becomes loose and there's descent of the organs. Then chronic cough. Then menopause, of course. In menopause, menopause, the estrogen hormone is responsible for the health of the vaginal bladder walls as well as the urinary passage.
Correct.
And so that worsens the condition after menopause. And age itself causes the laxity of all the ligaments. And therefore that promotes stress urinary incontinence. Also chronic cough, chronic constipation, and then lifestyle changes, like obesity, smoking, caffeine to a certain extent, colas, lots of fizzy drinks, spicy food, surprisingly.
Spicy food, how?
Spicy food is a trigger for urinary incontinence. Really?
But what is the logic?
It's research. It's just a stimulant.
Oh my God, I would never have thought spicy food causes...
Don't forget, I told you about the brain and the bladder control.
Yes,
there is a neurological factor. So that comes to causes in men. Men have enlarged prostate, if they have enlarged prostate, or even after they've had prostatic surgery for prostatic cancer. Some of the medications also causes it. What happens in men is that they have overflow incontinence. There's some obstruction to the outflow. So the bladder is never completely empty. And then there is a constant dribbling like overflow. And then there are neurological conditions like Parkinson's, stroke, multiple sclerosis. All these conditions also cause incontinence.
Again, because of the brain and bladder connect. Now, this is very enlightening and very important to know. How do you diagnose it? Of course, a woman will come to you and talk about the leakage or, the excessive...
Absolutely. I find, for diagnosis, I have to actually bring it out of my patients because they are so embarrassed.
Embarrassed to talk about it.
So I said, then I asked leading questions. They said, we have this urinary problem. Then I have to ask leading questions. Do you leak when you cough and sneeze? Do you have, so history taking is very important. You have to ask a proper history. Where do you leak when you cough? Do you leak? Do you have urgency incontinence? Do you have to rush to the bathroom? By the time you take off your clothes, does urine come out? Do you leak all the time? So history is very important. And then I asked them to keep a bladder diary. In the bladder diary, they have to note how much fluid they take, how often they urinate, and how many accidents happen during the day. So that's a very important method. And then ask them questions about what are the triggers. Did they have difficult delivery? Did they have a forceps delivery, vacuum delivery? Did they have enough rest after the delivery? And also, do they have chronic constipation, chronic cough? Have they put on weight of late? These are then for men, of course, prostatic problems, difficulties. And, very often, many people have stones in the bladder. And because of that, there's no improper outflow. And because of that, they have overflow incontinence. So history taking is very important.
Correct.
Then examination is also equally important. Examine to see, ask a woman to cough. It's called the cough stress test. So ask her to cough. This is the one time you do a gynec examination without asking the patient to go to the pass urine before.
Correct.
Because she comes with a full bladder or semi-full bladder, and then you ask her to cough. And when she coughs, there's a stream of urine coming out. And then you put 2 fingers above and lift up the bladder neck, and then no incontinence. Then you know that this is definitely.
So it's a manual physical test.
It's a physical test. Absolutely.
Do.
And then, of course, you look for other things like for constipation, you look for piles and, ask other leading questions.
Absolutely.
And then there are also other tests, like very good tests called urodynamic studies, where we actually test the pressure in the bladder, how the urine flows, is there any obstruction, etc. So it's called urodynamic studies. That will also help us to see whether it's a stress incontinence or whether it's a urgency incontinence, and 25% are mixed incontinence. They have both. So the treatment differs.
Correct.
You can't do a surgery for stress incontinence when there's urgency. It will worsen.
Absolutely.
So then we do proper sonographies to see whether there's any extraneous factors like a fibroid or anything pressing on the bladder. Then we do cystoscopy, put in a telescope inside the bladder to see whether there are any stones, whether any polyps causing this, whether there's recurrent urinary tract infection is one of the commonest factors for overactive bladder and urgency incontinence. So a urine culture, etc. Then we come to the diagnosis. Now we know what we are dealing with and what is the cause. So we treat the cause first. And then the actual treatment is basically the most important treatment in stress incontinence after treating the cause would be lifestyle change. Believe me, that is the game changer.
Let's talk about that. So what are things, because people like us should know what are the things that we can do and cannot do.
Absolutely. So for lifestyle changes, if you have to maintain a good weight, lose, because whenever one puts on weight, there's pressure on the bladder.
Correct.
So, and proper voiding habits. So we do what is known as bladder training. We ask patients that in bladder training, try to delay it. The first thing is delay. Try to keep at least a 3 hour. So even if you want to go, delay for some time. And then double voiding. When she voids, pass some urine, wait, again pass urine. So there you empty the bladder completely. And the third is always go to the bathroom every 3 hours during the daytime. During the evening time, after 7, drink plenty of liquids during the day. After 7 p.m., don't have too many liquids. So that you don't have to get up at night. One of the biggest problems is insomnia because of wanting to get up at night.
People wake up at like 2 o'clock or 4 o'clock.
3 o'clock, 4 o'clock, and then
can't fall asleep.
Can't fall asleep thereafter. So that is another way lifestyle change.
So avoid a lot of liquids after 7 so that at least you get that continuity in your sleep.
Avoid caffeine. Avoid smoking. Smoking leads to urinary incontinence. It's a known factor. So these are the
What is the logic for smoking?
Smoking, the nicotine, etc. All these are
that's the impact.
These are all nerve stimulants.
Nerve stimulants.
They're all
that's
nerve
the
stimulants,
point.
and that's how it works, because it's then you get a neurological bladder. That
now that makes sense.
Yeah. Then another very, very important component is pelvic floor training, what we call Kegel's exercises.
That's the most important.
Now, this is the most important because many women, I would say 30% of women with Kegels would do well. But Kegel's exercises, you just don't tell a patient, Google Kegels and do that. No, it should be supervised pelvic floor muscle training.
Can you tell us a little bit more about that?
So you have to, there are urogynecologists, physiotherapists who teach the Kegel's exercises, where the muscles between the thighs, you have to hold tight as if you're holding a pen or an object in the vagina. Hold tight, leave loose. Hold tight, leave loose. And we actually measure the strength of the vaginal muscles.
How do you do that?
You, when the woman is holding tight, you do a per-vaginal examination or per-rectal examination and actually feel.
Okay.
Yes,
news to me.
Yeah, so this is how you actually do. Then you exercise and train the woman so that you know exactly how much pressure to give, how often. You can do that about 10 times, 3 times a day, and the pelvic floor becomes nice and tight. Kegels exercises we even do during pregnancy towards the end. After delivery, must.
How often?
You know, you can start off soon after the delivery. It's just to a count of 10 of these exercises 3 times a day. Okay. When you're sitting, standing, lying down, when you remember, just do it.
So that's about right. 3 times a day, 10 counts.
10 counts. That's more than enough. And then you do it when you're perimenopausal. When you have early stress incontinence, also you can do it. And we find that many patients are benefited by this. Also, you know, so many women come to me for literally designer vagina, you know, after
designer vagina.
Because
what is that? That's something nice to hear.
Because after menopause, the vagina becomes very loose and the husbands start complaining that they, you know, there's no tightness of the vagina. And then women come for vaginal tightening. Now, rather than do the surgery, we actually can give them pelvic floor training.
And it works. It
tighten the vaginal walls, of course, and we instruct them that during the act also you do the this vaginal tightening.
Oh my God.
And it works wonderfully.
And then you can avoid surgery, basically.
And you can avoid surgery.
If you do it on time.
Absolutely. So these are the things which women don't know and they should know. So this is what I would suggest. And then, of course, if everything else fails, then there is surgery.
Okay.
Now, surgery is wonderful. There is a beautiful tension-free vaginal tape called TBTO.
Okay.
Earlier, we had to do it through with cystoscopy, etc. The old TBT. Now we have a very simple one, which is an outpatient procedure where we, through the vagina, put in a tape and that just lifts up the bladder neck.
How long does this take?
Lifelong. No, it takes 15 minutes.
So it's a 15-minute intervention.
And,
outpatient.
And then that tape becomes part of the body and remains lifelong. I have done it for 70-year-old ladies also who say, you've given us a new life. Change their complete life altogether. And it's so wonderful. Immediately they are continent. So that is one. Then there is a laparoscopic birch colpus suspension also. But, you know, most women, why do something which is so complicated with anesthesia where you can actually get away with this small tape, and these work very well. Okay. There are, for those who cannot have surgery, there are injectables that we can, they are called bulking agents. Just below the urinary sphincter, we put in silicone pellets, etc., injected there, and that sort of thickens the sphincter so that it doesn't leak.
You know how you said TVT stays lifelong?
Yeah, this also stays.
The injectables also lifelong.
Yeah, will stay lifelong.
So and why would you, if it's very extreme, you would do TVT?
Because bulking up helps to a certain extent, but it's not tension free. It's not 100%. It remains there. So sometimes it may cause, you know, we may have to do urethral dilatation because then if it becomes too tight.
Got it.
You know, so it's okay for those who cannot have this surgery.
Is still the preferred.
It's still preferred
option.
Of surgical, it's the best. Then if those who cannot have anesthesia or who are not fit for surgery, like older women, then we can do that. Now when it comes to overactive bladder,
okay,
what are the treatments for that? We can give the bladder relaxants, what we call anticholinergic agents.
Okay.
Do urine cultures, treat the other causes, but then after that help so that the detrusor does not contract so much. So that will help to a certain extent. And then we also have, for those, if that doesn't help, bladder training doesn't help and everything doesn't help, then we have Botox injections which can be given to the nerve of the bladder, so that the detrusor muscle doesn't go on.
Botox for the bladder.
Botox for the bladder. It works.
That is
wonderful.
That designer vagina, Botox for the bladder. You're like some encyclopedia.
But it's true. And overactive bladders have been treated with Botox. And then for neurological bladders, there is we have a stimulator which can be taped onto the body, and that the wire goes inside and stimulates the bladder, so that, you know, there's no overactivity.
And
so
that's permanent. That's also
permanent. That's also a permanent wire. It's called neuromodulation.
Okay.
So these are the various techniques, and this is the various treatments, Namita.
Lovely. And all these
so much all is available.
And all of them seem like they're fairly, easy.
Yeah. Very easy.
Fast and not very painful, and options
not
to
very
find a solution.
And as Robina and Triti will tell you, 16 years, 18 years, continence after that, yes.
In fact, the perfect segue to Rovina and Thriti. Thank you so much for joining us. Rovina, let's start with you. What exactly happened and how has TVT changed your life?
Actually, I was having this incontinence for some time. And the most embarrassing moment was when I visited a friend, and I've got this habit of laughing very heartily. I messed their sofa.
Oh.
Now that was too much for me. I didn't know what to say.
How old were you?
I was just 51.
Young. Huh?
Very young. And I know now after listening to Dr. Kiran what was the cause of it. I'm a big coffee drinker. She said 5 cups. I think I have 7 cups a day. You know, so that must have been the cause because at such a young age, I had terrible incontinence. So one day out of real distress, I met Dr. Kiran, who happens to be also a family friend. She said, Rovina, you are suffering from incontinence. Come and see me at the hospital. I said, yes. And I went. It's a very painless surgery. You don't feel anything. It's like doing a DNC or whatever that is.
Correct.
And ever since then, I was wanting to travel. But I could not travel because of, you know how the distance is in America. One toilet is the next toilet is in Los Angeles. You know?
Correct. Yeah. Absolutely.
So and you cannot tell them, stop, you can't do it like in Bombay.
So it impacted your life in terms of
terrible,
just not wanting to travel.
And all the time, you know, so careful. And I can't stop my laughter. So what to do? So anyway, after this, sweet. I'm so free. And when I see my friends, running every time. I go to a theatre, I never use the toilet. And they say, you don't feel anything? I said, no, you need something. You need help, I tell them. Lovely. And I tell them about Dr. Kiran Coelho's surgery that she did on me. Procedure.
You know, you told me a little secret also, which I want you to tell our viewers about the magic of Kegels in your life.
Yes. She told me that you have to do this exercise. And I've been doing it. And I went on Women's Day in March. I went for a women's checkup. And when I went for the sonography, the doctor asked me, he kept on looking at me, he said, Madam, are you married? I said, Doctor, what's wrong with you? I'm a grandmother. Why are you giving me a proposal? He says, no,
that's how tight you were.
He says, you know, yes. He says, it is, your walls are very clean and clear and tight. My husband was not very happy to hear about it, but he's comfortable with it.
But that shows the power of Kegels, right? So because Dr. Kiran told you about it and you started at the right age and did it the right way.
Today I can stay for 6-7 hours without using the toilet and never ask where the toilet is, ever.
And you said it's been 17 years.
17 years.
Since the surgery.
Yes.
I'm so glad you shared that, Rovina.
Yeah.
Thriti, why don't you tell us your story?
Namita, I was a working woman traveling long hours by train and then long hours of work. And I had this urinary incontinence, which she explained as stress urinary incontinence.
Hers was at 51. What about you?
I was 48. And my causes would be pregnancy, childbirth. I had twins.
Oh, yes.
I had a pair of twins.
Push.
Yes.
But that twins and
a normal natural delivery twins.
That definitely explains it.
And an hysterectomy. So it was after hysterectomy.
All of that put together.
And I was delaying it because of the working life and dealing with it and wearing sanitary pads all the time.
Right.
I said, this will not do. And one day I went to her. She's a very good family friend. I told Dr. Kiran Coelho, whenever I'm coughing, sneezing, laughing, I'm just passing urine. What is this? So don't worry, Thriti. There's an excellent solution. It's TVT. It's tension-free. The name itself suggests tension-free vaginal tape. And it will be done. It was just a day and a half in hospital under local anesthesia. After that, it has been 16 years.
But this is brilliant, Kiran. I mean,
Absolutely.
so many women's lives have impacted.
I bless her for it.
I must really, I know, I must thank both of them. And you know, that was actually the message I wanted to give all women out there. And that's why I started the incontinence clinic as well. Is that, you know, gone are the days when, you know, women live a long life. We have longevity. And about 1/3 of our lives are going to be spent in the postmenopausal state.
Absolutely.
So one must have a quality of life.
Correct.
Yes.
When you are incontinent, your quality of life goes. For one reason, You can't have a social life. You have to wear pads. Wearing pads all the time causes skin irritation and fungal infections. You are not confident to go. And most people have their children abroad. You can't travel abroad. You can't travel. Your whole life gets curtailed.
Absolutely.
Number one. Number two is that when you have symptoms, you must go to your doctor, because you can see some underlying factors. There may be polyps, there may be growths, there may be prostate, there may be so many other things which would have gone undiagnosed if it wasn't for the urinary leakage.
Absolutely.
And the third is, as one gets older, getting up and going to the toilet, you may have accidents also, fracture your femur, etc. Whereas when you're continent, then you have a better quality. So overall, a better quality of life with simple exercises, simple procedures. It's not a big thing.
So thank you very much for joining us,
for
educating us, for inspiring us, and for pushing us to get these simple procedures and lead a productive life and be the best version of ourselves, and most importantly, to not hold that laughter back.
Yes.
Yeah.
That's most important.
Very important.
तकदीर अपनी उजली ढूंढने है वो निकली, तकदीर अपनी उजली। इल्ली ने मन में ठाना है, बन के उड़ना